Step 12, down regulation. Before you start IVF treatment cycle, your specialist decides your protocol. So one of the important parts of the protocol for your IVF is deciding what down regulation regime you will use during IVF treatment. So before that, I will explain what does down regulation mean. So generally, when you're having natural menstrual cycle, as you're developing follicle, as your estradiol levels are increasing, your pituitary gland on the base of your brain senses that there's a large follicle ready for ovulation. Then it sends LH hormone to trigger off ovulation and rupture that follicle so that egg will be released. So, and then actually in IVF cycle, we don't want this to happen when your follicles are developing, because we want to go and collect the eggs. So during stimulation, if you have ovulation, if you have a LH surge, then whole cycle need to be cancelled. So that's why we need to block the pituitary gland during the stimulation. We need to take over the control. We should regulate your cycle, not your pituitary gland. So for that, we need to shut down your pituitary gland. So that's called pituitary down regulation. So there are two ways you can shut down the pituitary gland during IVF cycle. One, by emptying the pituitary gland so that it doesn't have any trigger hormone, LH hormone left inside. So pituitary stores FSH and LH. So you really want to empty the pituitary so that it doesn't interfere with stimulation. Second way of blocking is by blocking receptors of the pituitary gland so that it doesn't sense that there are follicles which are ready for ovulation. So these down regulation regimes are called agonist and antagonist regimes. So now I will explain how it works in practical terms. Okay, so I will take you through your IVF journey to explain when and how we use down regulation regime. Okay, let us say you have done your baseline workup, you have spoken to your specialist, and you have created treatment plan, you've spoken to the nurses, got all your drugs. Now you're waiting for your IVF treatment to start. So you wait for the period, then you have a period, you do blood tests, then you start your ovarian stimulation. From first or second or third day of your period, you start stimulation drugs. This is FSH drugs. So this stimulation lasts approximately 10 days. Then you have a trigger shot, then you do egg collection. So before that, you need to block the pituitary so that you do not have a surge of ovulation hormone while you're doing stimulation. So that starts normally from day 5, because until day 5, your pituitary doesn't send there are follicles. From day 5, day 6, your pituitary starts getting active. Before that, we need to block the pituitary. So as we said, we can block by using agonist or antagonist regimes. So essentially there are 3 different type of regimes in IVF. So one is called antagonist regime, second is long agonist regime, third is flare agonist regime. I will explain the difference between these regimes and how we use those regimes. First is antagonist regime. So in antagonist regime, you start with stimulation drug, FSH. So you continue until day 4, day 5. Then you add your antagonist drug, so second injection. So, and these injections are called cetrotide or orgalutran. Cetrotide is cetrorelix, orgalutran is ganirelix. They're equally effective drugs. And there are 2 different types of antagonist starting protocol. One is called fixed, which means for all patients, you start antagonist on day 5 or day 4. Then second is a variable, which means you monitor the follicle. If you see large follicle and high estradiol levels, then you start. So you individualize that starting day. So fixed or variable. So second regime is called long agonist regime. So the reason it's called long agonist regime. In this regime, you will be on injections longer, approximately a week longer. So that long agonist regime starts a week before your menstrual period. So which means day 21 of your preceding menstrual cycle, you do blood test and you start long agonist injection or nasal spray. So there are 2 different type of drugs for agonist regimes: decapeptyl injections daily or nasal spray called Cinarel. So, and once you started this injection, you can continue until the trigger. So you start the injection daily. Approximately about a week or so, you have a menstrual period. It's very important. You should have full menstrual period. Then you do baseline bloods. Then you start FSH injection. So a week after starting decapeptyl or Cinarel, then you start your FSH injection and continue both agonist and FSH injection until the trigger. So, and then of course you don't need to do any antagonist injection, and then trigger, and you have a collection. Third regime is a flare agonist regime. So you use the same drugs as a long agonist, decapeptyl or Cinarel, but you start agonist from first or second day of your period, not week before, first or second day of your period. So, and once you started agonist, again you continue until the trigger. So, and what it does is, when you have a agonist on the first or second day of your period, you empty your pituitary gland of LH and FSH. It gives a flaring effect. So first 2-3 days you prime your follicles with your own natural FSH and LH. So this is why it's used in patients with poor responders, FSH receptor polymorphism. So, but after 1 or 2 days you run out of your natural FSH and LH, then you have to use additional FSH from second or third day. So then continue that FSH until the trigger. So now I will explain how we decide which regime to use. Essentially, today most commonly used regime is antagonist regime. Probably across the world, maybe 90-95% of patients undergo IVF using antagonist regime. Why? Because this is the simplest and safest regime, and also it helps to reduce the risk of ovarian hyperstimulation syndrome. So if you have a PCOS, certainly antagonist regime is the right regime for you, for example. So a long agonist regime is used in selected patients if they have very poor response, and also in patients with severe endometriosis. Flare agonist regime is used for optimization of IVF if you have a poor ovarian response, if you have a problem with maturation of the follicles. In selected patients, it's used as a part of optimization protocol. So you can see from here that effective blockage of the pituitary gland is very important in IVF, and selection of these regimes are also important. So you need to find out what regime you're using for your cycle, and if you have any questions, you should discuss with your specialist why you're using certain regime, not the other regime for your IVF.